Hi, my name is Kubaska, and I'm going to talk to you about universal health care and how that would look like in the United States. I'm going to start with a quote by Joe Kennedy III, who was a representative from Massachusetts. "There is no mercy in a system that makes healthcare a luxury. There is no mercy in a country that turns their back on those most in need of protection: the elderly, the poor, the sick, and the suffering." I agree with this 100%. I feel that as being one of the wealthiest countries in the world, we should be able to provide health care to everybody. What is universal health care? By definition, universal health care is a healthcare system that provides health care and financial protection to all citizens of a particular country. It is organized around providing a specific package of benefits to all members of a society with the end goal of providing financial risk protection, improved access to healthcare services, and improved health outcomes. Universal healthcare provides structure to a healthcare system by reducing costly practices that do not contribute to direct patient care. The map shows the current healthcare structures in countries all over the world, ranging from free and universal healthcare, which is in the green in most of the countries in the world, to no free or universal healthcare, which is seen mainly in the United States and their territories. Why do you think that the United States has not adopted some version of a universal healthcare system? Money. The United States has allowed costs of healthcare to get so out of control that correcting the system would be detrimental to the country's economic growth. Now, why should the United States move to a one-payer government-funded model? Every legal citizen will have access to basic medically necessary health care. Wasteful and expensive administration fees are reduced, decreasing inflated healthcare costs. Drug prices will decrease. General debt and mostly student debt will decrease. The increase in demand for healthcare professionals will create more jobs, higher skilled jobs, higher paying jobs, and healthcare spending would decrease due to a healthier population, actually strengthening the economy. 30% of healthcare costs are due to administrative fees, which aren't related to direct patient care. That means for every $20,000 of healthcare expenses paid by patients and employers, there is $6,000 that do not benefit the consumers. These administrative fees come from having to pay multiple people to submit claims to multiple insurances, along with having to pay people to either accept or reject the claims, and then paying people to appeal denials to get the services paid for. This is all wasteful, busy work. The government, insurance providers, and medical care providers lack structure and standards that protect the consumer's pockets. There is no set dollar amount to have your blood pressure checked or any other kind of service. There's no one regulating them. So it's not uncommon to see a different price at another hospital. So due to the lack of structure and the regulations surrounding healthcare costs, insurers and providers can charge what they want, and they're hanging the patient out to dry. There are many benefits to a universal healthcare system. By going to a one-payer government-funded model of healthcare, every legal citizen would have access to healthcare regardless of race or social class. This would decrease healthcare spending because every citizen would have access to preventative and medically necessary care without the fear of debt due to the inflated healthcare costs caused by administrative fees. The basic preventative care that citizens would have access to would create a much healthier population, which is bad news for pharmaceutical companies who sell their overpriced medications or insurance providers who charge higher premiums for sicker people. To balance The negative impact on the economic growth, a one-payer government-funded model would decrease the consumer debt and bankruptcies, actually giving a positive economic result. A healthier population would result in a healthier workforce and also increasing an individual standard of living. People who feel good want to live good, which means more highly motivated individuals to pursue those higher skill, higher paying jobs, which will contribute to economic growth in the United States. There are some potential setbacks to a universal healthcare system, but there are positive outcomes to those setbacks. Free does not mean perfect, and sometimes we have to give a little to get a little. By offering free basic medically necessary health care to every citizen in the United States, there will be a higher demand for care providers, and if the government does not put a well-rounded change readiness plan into place, the wait times to see a care provider will increase dramatically. But as long as the government puts plans in place before executing anything, then there shouldn't really be a negative impact on the consumers. Increasing taxes, which is another concern, in order to pay for healthcare coverage for every legal citizen due to this new model, is a big concern. However, if the government evaluated how they handled the Federal Insurance Contribution Act and disposed of the maximum taxable income threshold, the additional dollars collected would make the tax increases for the people who don't make 6 figures a year less overwhelming and the overall implementation of the system more manageable. In some countries like England, students on the path of being doctors are given free tuition in exchange for taking a lesser salary than if they were to pay for a very high tuition in the United States and practice there. If the United States adopted this practice, then not only would you decrease student debt and gain the amount of care providers that you needed to accommodate the increased demand, but you would also make improvements on economic inequality and creating a stronger economy all at the same time. The concern that healthcare professions will no longer be appealing due to the decrease in salary and creating shortages in doctors, nurses, and other care providers shouldn't be a worry, because salaries in other countries for these professions are nowhere near this high, and many people are happy with their work and salaries. It just takes time to get people to accept the changes, which you can see the United States currently pays the highest, but there's plenty of other countries who pay doctors and other care providers less, and they're doing just fine. There is speculation that a universal healthcare system would lead to a socialist state by giving the government control over decisions regarding healthcare. This could happen, however, there are alternative outcomes. The government will indeed have to set standards and regulations to protect the consumers and now their own pockets. The United States has a network of checks and balances to guide government officials into making the right decisions at the right time. When personal agendas are put aside and the welfare of an entire country is put first, some form of universal health care will benefit consumers much more than the current system that we have now. Currently, there are no government agencies hashing out pricing for medications, which means pharmaceutical companies are making a higher profit on the United States, who also consumes the highest amount of prescription drugs throughout the world. By getting government officials more involved, they will now have to negotiate with drug companies for the best pricing, just like Switzerland, who pays far less for prescription medications than the United States. By obtaining lower drug costs, there will be more resources to spread out over healthcare. The thought of universal healthcare in the United States decreasing the quality and innovation of care practices is easily put to rest when looking at Japan's healthcare structure. Japan's high focus on preventative care has led them to be one of the healthiest populations, and their ability to innovate low-cost healthcare technology has put them at a great advantage. Body scans in the United States can cost thousands of dollars, and in Japan, they cost a couple $100s. This kind of innovation allows the detection of growths and abnormalities in the body to be detected much sooner as part of a preventative care regimen than in the United States, where you only get these scans due to serious illnesses, and then you end up having to pay for a lot of those scans because you have a deductible that you have to meet. And by identifying and addressing all those costly health concerns earlier, it leaves opportunities to decrease healthcare costs. If the United States adopted a one-payer government-funded healthcare model, every legal citizen will have access to basic medically necessary healthcare. The wasteful and expensive administration fees are reduced, decreasing the inflated healthcare costs. Drug prices will decrease. Debt will decrease. The increase in demand for healthcare professionals will create more jobs, and healthcare spending would decrease due to a healthier population, strengthening the economy. Not every country who has adopted a universal healthcare system runs perfectly, but by taking bits and pieces from the most successful countries like Taiwan, the opportunity to create a well-rounded healthcare system that is available to every legal citizen is possible. There are flaws, but the United States has an opportunity to learn from other countries' mistakes and set a new bar of high standards in healthcare. I'm going to leave one last quote by Winston Churchill. The positive thinker sees the invisible